So thank you for being here. My name is Amber Jones, and on behalf of the Southeast PTTC, we are glad that you are here to join us for today's webinar. So I am going to go ahead and do the disclaimer. We're always required to do this disclaimer because this center, along with all the other centers in the network, are 100% supported by SAMHSA of the U.S. Department of Health and Human Services. And here comes the disclaimer. The contents are those of the authors and do not necessarily represent the official views nor an endorsement by SAMHSA, HHS, or the U.S. government. Here is a graphic, a really great graphic of the PTTC network. If you are new to attending any webinars from our region, we welcome you. Maybe you've attended a webinar with another region. Thank you for being here. And there are 10 regions across the United States and beyond. And our region is Region 4, the Southeast, the best region, arguably. And we are housed at Wake Forest University School of Medicine, led by co-directors, Doctors Wagner and Wolfson. And I say that jokingly. We have a really amazing group of centers across the United States. Okay, the housekeeping. Yes, you will get a certificate for attending today's webinar. Whether you need a certificate or not, we really encourage you to please fill out that evaluation form. Your feedback is important to us. And I promise you, it doesn't take very long. So again, please take that time to fill out the evaluation form at the conclusion of today's webinar, and you're going to get a couple opportunities to do this. During question and answer, we'll go ahead and drop a link in our chat box, and then we'll also pull up a QR code. So you have that opportunity today, and then a couple days post-webinar, I'll send out an email with all today's information. You'll get the slide deck, you'll get the evaluation form link, and then you'll also get the link to where you can see the webinar on our YouTube channel. And again, it'll take a couple days to send that post-webinar email, so go ahead and look out for that, please. All right, if you are not already our friends, we hope that you'll want to be our friends and join our newsletter. Our newsletter highlights any upcoming trainings and webinars that we have within the region. And so again, today's presenter, sorry I only have Kathleen's picture on here, but she is going to go ahead and introduce the organizations that she has partnered with in the state of Florida. So it is my honor to introduce Kathleen Roberts. She is the Chief Executive Officer of Community Coalition Alliance, and she has over 15 years of experience working in behavioral health at the local community level, regional level, and state level. She received her Master's of Science in Criminology from Florida State University, go Florida State, and also a Master of Science in Criminal Justice from University of Central Florida. And her role at CCA is that she works with community coalitions, providers, and partners to assess substance use trends through data collection and analysis, research, partner engagements, and community assessment. And so with that, I'm going to go ahead and hand it over to you, Kathleen. Thank you so much for being here.
Thank you so much for the opportunity to be here and to share out the amazing work that's happening in Florida. What is so exciting about the work that we do for prevention is that we've really figured out the best recipe, which is collaboration, collaboration, and collaboration. None of the stuff that we've been able to do could have been done by just one organization. And so that's what we want to share out here today, is that when working together, you're able to leverage so much more of the resources, reach such a larger audience, and be able to accomplish things that otherwise you could just dream about. So we're thrilled for that opportunity. And I'm joined here today by several of our partners and organizations. Super excited to have some of our coalitions from Drug Free Duval in the Jacksonville area. We have our Putnam Health and Wellness Coalition from Putnam County in Florida. We also have our National Guard with the Drug Demand Reduction Outreach Team. And then we're also going to bring in and talk about what we do with Community Coalition Alliance. So with that, I will go ahead and share my screen. Let's see. Let's hope the technology wants to cooperate. All right, I think I'm sharing my screen. All right, perfect, good. With technology, we just always take a deep breath and go, please work, please work. All right, so today this is a part 2 of a series that we started with talking about community organizing in action. And today we're going to be talking about the tales from coalitions in Florida. What is so great about what we're going to be sharing out here today is you'll be able to see about what it takes to bring in the change and to be able to do projects and initiatives. It's because we are able to bring in so many different partners together and work in a unified front. So let's see. So before we get started into who these different organizations are, I'm going to tell you a little bit more about Community Coalition Alliance. For those of you that joined us in part 1 of our series, you heard some of this, but I'm sure we also have some new folks that joined us here today. So we are a coalition of coalitions. Our mission is to serve as that collective voice of our community coalitions, as well as our community partners, to work together towards the health and wellness for all Floridians. We bring together all these different coalitions from rural areas, urban areas, combination of those different types of geographic areas. We also bring in different partners from different parts of our states. And then we're able to come together to share what's going on, what are some barriers, what are some challenges. They're not all the same, they're all a little bit different, but there are similarities across. With this opportunity, we're able to overcome barriers and issues, and we're able to come up also with new ideas and recommendations for how do we move forward. So our vision is that of communities that work together to provide Floridians a healthy and safe environment in which they can thrive. And that's what you're going to see here today with the different share outs that we have about some of the amazing work that's happening. And this wouldn't be happening if we didn't all come together. So with our organization, we have membership from coalitions and community partners from across our states, and we're able to bring in a number of different pieces to the table. So yes, we have the membership opportunity where everybody can come together, we can brainstorm, we can network, we can leverage our efforts, but then we also have opportunities sometimes to bring in some funding and provide some oversight to help build up that capacity. We do a lot of training and technical assistance on our team. We have trainers who are certified in the SAPS training piece. We have trainers who are certified in mental health first aid, resiliency, and a number of other topics, so we can bring that to the table of all the different communities we're in. And then we work a lot with engaging new partners. Again, we can't do this without collaboration, so it's always important to find who's going to be the next partner to bring into the fold. Who else can we reach out to? And what are some partners that we hadn't even thought about to be a part of this? You're going to hear about one of those examples here today. So our members are sprinkled out throughout our state, though we do have a lot of partnerships in the rest of our state as well. But this is just a listing of our formal members that are in the Community Coalition Alliance. And so today we're going to be talking about how this looks like in action. One of the things that we talk a lot about in our groups is that we don't like to have meetings just to meet. We don't want to look at data just to look at data. We want to take ideas and data and turn them into action. So we wanted to have the opportunity today to provide this webinar with examples of what that action looks like. Yes, we'll talk a little bit about some of the foundations and some of those key elements and pieces, but then we're going to turn it over to give you an example of this is what that would look like. So it's not just this idea and concept, but we'll give you the idea, concept, and then the example of. So through this presentation today, we're going to explain how to build that community readiness and resource to address those local needs. We're going to describe how to prioritize local risk and protective factors that influence priority problems. And we're going to talk about how to integrate prevention strategies into behavioral health planning and activities. And so with that, we'll go ahead and get into our presentation here today. Everything that we do is guided by the Strategic Prevention Framework. That is the foundation of all the work of coalitions and the partners that we work in, because the way that the Strategic Prevention Framework operates is like a way of thinking, but using the data to guide that thinking process and ensuring that we're putting in consideration for sustainability and cultural competence. So what we will do with this work is we rely on the evidence, we look at the research, we make sure that we're incorporating that cultural awareness component throughout the different phases of the strategic prevention framework, and we make sure that we keep that sustainability in the forefront. If we take those things and keep them into account as we go through each of the planning phases, then we're more likely to see those efforts that we do continue on beyond a project time frame. And we follow this strategic plan. And as we go through, we also do, I know evaluation is usually mentioned there at the end, but we do those components throughout to make sure that as we're implementing, we're taking into account what's working well, what's not working, do we need to adjust, where do we adjust, when do we adjust, and what things do we not need anymore? So the strategic prevention framework really guides a lot of that work around prevention. And you'll see that mentioned throughout the different share outs that we have here. Because what this does is it helps us to understand the prevalence and the patterns of those problems and factors that contribute to them. It helps us to identify where are our resources, where do we have gaps, what do we have available, what do we still need. It also helps us to make sure that we're relying on the research. Oftentimes prevention kind of gets the rap of, oh, that's the things that we do when we celebrate red ribbon and we wear red and throw a pizza party. Well, prevention is much more than that. Prevention is a science, it is evidence-based, and it is effective as long as we're ensuring that we're doing what the research shows us, following the data, and implementing things with fidelity. And so assessing where we are in those measures and how things are rolling out and where we need to adjust, that's what makes prevention successful. And it is a science. So oftentimes when we talk about prevention, we bring it to the table as this is a science. We are teaching scientists, we're training the future scientists to come together and be able to create this change. So a little bit of a recap from our part one of the series. In part one, we described how to assess community norms and behavioral health priorities. We explained how to assess community readiness and address behavioral health issues. We explained how a community can build momentum and engagement to enhance its capacity. And today we're going to show you what that momentum looks like. What does that engagement look like in reality, in action? And then we also describe the importance of that consistent and meaningful engagement to sustain alliances and collaborations. That is such an important piece because when it comes to partnerships, if you're only engaging when you need something, you're going to lose that engagement. And what you're going to hear today with those examples from our various partners is that constant engagement and intentional engagement is what has led to these successes that we'll hear about here today. So as we go through, it's really important to know what is it that we need to assess. Well, we need to look at the nature and extent of substance misuse problems and related behaviors that then also help us to identify those risk and protective factors that influence the problems and behaviors that then reach into the existing resources and readiness of the community to address the problem. And as we think about those key components, we need to understand the description of our community. We need to know about the history. All of these elements provide the context to understanding where you're going to be working in. If we better understand what are those different elements, that helps us to understand some of the reasons as to why things exist, or some of the reasons as to why some things are not working. And then looking at what those needs are. What is missing? What are some of those gaps? And then looking at what do we have? What is available? So we can build up on that. And then looking at what some of the problems are that we want to address and create those goal statements. Those are the key components as we look in working with communities. And then as we have learned over the last few years, especially since COVID times, is we need to start embracing that virtual arena. There's so much information out there. I know for many of us, coalition work and prevention work was in the field, out in the community. But then COVID made us pivot a little bit, and we had to really embrace the virtual arena and what that brought to the table, which for some it was a struggle at first, but we realized we actually were able to engage even more folks sometimes, people that sometimes didn't come to some of the events. So there's a lot on the virtual arena that provides opportunities for us to engage. And that means, including things like the AI options, looking at virtual meeting spaces. We are able to not move away from in person. We absolutely need that. But knowing that we also have this as another tool, it also allows us to better expand data gathering. There are so many places that now have their own dashboards that give out wonderful information that we can access in places that before we couldn't. So all of those things are available, and being able to rely on multiple different indicators. I mean, when we look at those key components, there's so much a wealth of information within each of those sections, and looking at all of these different things helps us to really create that bigger picture and understanding what kind of issues communities are facing, what are the things that are their strengths in those places, and where can we go from there. That helps us to make sure that we really are doing what we need to do as scientists in this field, which is making sure that we're following the evidence, looking at the data, and bringing the picture together. So that's how we get that full picture. It's looking at all the information, pulling it all together, and making sure that we're using that to inform the decisions. And that's how we connect the dots. We gather the information, we get the input from the community, we look at the resources available, and then we form those connections. And those connections lead us to the buy-in, and those buy-ins lead us to collaborations. And those collaborations is how you get the amazing work that seems to be happening in all these different places when different organizations come together and have intentional connections. So we mentioned a lot about this, the importance of the consistent and meaningful engagements. You don't want to just say you have a partner. You have to connect that partnership. You have to make sure that you have these engagements that are not just when you need something, but throughout the time that you have that connection, making sure that we're having those opportunities, that you're a part of the community here for the needs that you're looking into, but also the needs of those partners who you're trying to engage with. So what does that community readiness look like? What does it look like to you? And I know we have the chat feature here, so I'm asking the audience, for you, what does community readiness look like? And I don't know if I can see the chat from this view here.
It's okay. I can get it in the chat,
Okay.
Kathleen. Yeah.
Thank you.
I don't see anything yet. So if folks are willing to share, what does community readiness look like to you? Okay, we got one. Knowing what you as a part of the community want and need.
That's definitely helpful. It's really important to start with what is it that you know that you need? What are the things? Use that data to identify those areas. But community readiness can look different in different places.
So we have a desire to change, data, stakeholder buy-in. Yeah, that's not only the stakeholder buy-in, but the buy-in to change. Ready to move into action and ready to address a specific need. People and organizations showing up. Yeah, so important. Partner buy-in, desire to change. So we're having some repeat. Yeah.
Yeah, those are great responses.
Having the understanding and info and motivation to make policy changes. Yes, Mina, you're speaking our language.
That's awesome.
Moving things upstream, looking at environmental changes. Awareness, leadership, resources. I have to work with the community all the time. Networking is important and connects this person to needed services. Let's do a couple more. Community readiness looks like a community having leadership and support, awareness of issues, and willingness to enact change. Yes, this I think is a perfect one to end. Recognizing one group organization cannot do it alone. And this is why we brought Kathleen and her partners together to share the awesome work that they're doing, because they really are doing amazing work, and they're a great example of what it takes to bring different partners to the table.
I love that. You're right. That was a perfect one to end on because that's exactly what it is. We can't have just one group. It takes all of us to come together. And it's looking at that capacity, realizing where each one of the organizations have their strengths, what is still missing once we assess all of those elements, and then where do we go from there? So our readiness is coming. Our capacity building comes from the resources plus our readiness to build up that capacity, because we can have resources but readiness may not be there. Or we may have readiness, but we don't have all the resources. So it's that balance of both of those things have to come together to build up the capacity for the community, to create the change, to mobilize, to be able to do the amazing work that is needed out there. And one of the things that is so important to know is that we can't just do it with one agency, but it's also not just one or two. It is a whole wealth of individuals, organizations that have to come together for the work to happen. And so this is coming in from the different sectors that represent coalitions. And it was 12, but we moved into 13 with including also the peers, because all of these different perspectives bring a part of that picture that you need. They have access to information, they have access to some data, they have access to resources. And so if we start plugging all those things together, that's how we're going to get to that mobilization. That's how we're going to get to creating that community action that we need in order to create the change. And again, this is one of our favorite quotes, and it's in everything that we do. There's nothing about us without us. We can't go to a community and work on community change without having the community a part of that process. We have to have that inclusion. In order for that buy-in to continue, in order for sustainability to go on beyond the project period. So readiness requires understanding your local community, and not just one or two data points. It's really assessing all the different areas that you can look at. It's building that rapport, and not building rapport just when you're about to write a grant. It's not building rapport because you needed an MOU for a project you're in. It's building rapport even when there isn't a project coming up. You have to have those connections. Then strengthening the collaborative groups that exist, looking to see what organizations are already out there working, what kinds of partnerships are they in, raising that awareness. We may know everything that's happening, and it seems so likely that everybody else should know too, but not everybody is in our world of behavioral health. Not everybody knows all the information that we have access to and all the data. It's amazing that even for things that we know are in the news, that doesn't mean that the entire community knows all the details of it. So raising awareness is so critical. And then engaging your stakeholders in those various different groups in order to lead to that collaboration. All of these things have to come together in order to work towards that readiness. And then we have the different involvements. Now, there's different levels of involvements, and you don't need every sector to be at every level of the involvement. It just depends on where you are in the process, what projects you're working on. But if you need, some of the action happening, there may be organizations you need in your collaboration that maybe are just still at networking, or they are still in just cooperation. You have to assess where it is that you need the different organizations to be at, and then you have to build up that rapport, the expectation, and also the buy-in to be able to be there together. And as I mentioned earlier, the technology, it is amazing just how much technology can aid the work that we do. It is sometimes challenging because technology likes to give us issues, especially when we need to use it. However, there's so many great things, and technology is being used by so many other parts of our community and different organizations. So it's a way for us to use these tools. First, to understand what those tools are, but then to be able to see how can we utilize these tools in order to do the work that we do. These are the kinds of tools that you see other businesses use in order to expand where they are, the marketing that they're in, the arena. So being able for us in prevention to connect across social platforms, look at different targeted ads for social media, streaming platforms, geofencing, surveillance, accessing the dashboards, the more we start to better to understand how technology can fit into this work that we do, the better we're going to be at reaching a larger part of our community, the better we're going to be in gathering data and information and being able to market and reach out there. And so it's really important. So I see it disappeared as I was reading it. Somebody asked something about the surveillance.
Yeah, somebody asked, can you say more about surveillance and how it fits into this work?
Perfect. So surveillance is our opportunity to look and assess information on an ongoing basis. Kind of if you think about like surveillance cameras, you're going to be looking at footage, not from just one moment in time. You're looking at it over time. And so that's what we do with the data. In our organization, we have established the Drug Epidemiology Network Group, which is a committee that comes together to look at data on a monthly basis. So it becomes our surveillance group because they're looking at the information on an ongoing basis. It's not a report that's done once a year. It's a regular opportunity to come together. So that way, when we see changes, especially some of the sudden changes and shifts, we're able to see that at that moment and hopefully try to be a little bit more proactive in response. Because oftentimes what happens is we're very reactive. We get a report, comes out, the data usually is 2 years old, and then we go, oh, we've got an issue. Surveillance allows you to be able to look at those things along the way, not an after the fact, but in the time of. So for our groups, we're able to bring in partners from our like fire rescue team, our Department of Health, our HIDA partners, the local providers that are doing services. So every month we can look at what's happening in the now. So that surveillance allows us to make informed decisions of, do we need to increase awareness? Do we need to get more resources out there like Narcan or Datera? Do we need to do some more education? Do we need to market a little bit more about what services exist and where they are? So that's how surveillance fits into this work and how we use that as a way to guide where we go and what we do next. And that's also what helps us to keep looking and identifying risk and protective factors that are impacting our communities. But we can't just come up with oh, well, in the news, they said XYZ. We want to make sure that we're making those decisions based on our population, our community, and locally what we're seeing in there. And I'm sure all of you all on the call here today are very aware of the risk and protective factors, because that's really what guides a lot of the work in prevention, is understanding what are the things that have that the chance to increase some of those negative outcomes, as well as what are those things that help to reduce the chances of those negative outcomes. The more we understand what are those things influencing our community, the better we can look to find ways to reduce those risk factors and find ways to increase some of those protective factors. But the issue we face is it sounds a lot easier than it is, right? I know many of you go to meetings and we end up with hearing from those that are special interests, or they're on their soapbox and they're very concerned about this particular issue, and you come with all this data saying, but the data shows us this and this and this is where we should focus. And they come in with well, but I know this is important, and it's really hard to move past that. Sometimes there's also not necessarily all the data that's needed to be able to identify what those issues are. And how do we go from the scare tactic about headlines in the news to really what's happening locally? The money, that's been a big issue. Is oftentimes we have grants that become available, but what do we end up doing? We say we're data driven, we follow the data to identify the strategies to go and implement. And then we look at what money is available. The money says, you will focus on opioids, you will focus it in this way, and you will focus it like this. So we know we should follow our data and move it along, but then the money comes down and says, you will focus on this. So monies and the available supports sometimes kind of derail where we want to be focusing in on. There's ways to adjust for that by looking at shared risk and protective factors, but it's definitely a factor. And then there's, this when people don't want to acknowledge a problem exists. Many of us have encountered that, whether it's school settings, in a community setting. Oh yes, that is an issue, but not here, not my community, not my school. So these are some of the issues that do come up, but there are ways around it. And part of it is building up those collaborations. Part of it is making sure that we're sharing out the data. If we're just holding on to the data but not sharing it out, then of course they're not going to know what those priority problems are. We have to have that relationship where the data share outs go ongoing, not just once in a while when a grant is due, but ongoing. And so how do you prioritize? I mean, we've got so many different options and varieties, but that's something to think about as we look at, how do we assess the data and what are those different things? Think about how do you prioritize in your community? How can you work to build up that capacity with your partners that you have? And what is it you need to consider as you're trying to prioritize? What does the data tell you? Who is on board? What is realistic to tackle? What funding is available? And who is at your table? Those are all the different considerations when trying to prioritize those risk and protective factors that we're going to want to address that will relate back to the behavior and issues that you've identified from the data points. And working in communities, we know this is a lot more challenging than it sounds. We may have all the great data, we may have all the research, but I know some of you have experienced this before, showing up to a meeting and for some reason there's a different topic of interest, or they want to dismiss the data. Oh, well, data can be made to look however you want it to look. So part of this process is also educating the different partners that you work with about, no, we can't just, adjust the data. The data is showing us this. But that's why we also encourage to always look at multiple data points. If you have 10 different data points showing you the same picture, it's not so much that the data was manipulated. This might be the picture that's showing up because that's what the data is showing us, not that we adjusted things to make the data go to what we want it to focus on. And that helps us to look at, what are the things that are high importance? What are the things that are of low importance? How much is the risk and protective factors influencing the problems you've identified? What other issues does it affect? And what does this directly impact the developmental stage of the population as you're going through? It's really important to go and look into the context of the community you're working with, whether it's the larger county level community, state level community, or smaller in a sub part of your community, a health area, a school zone, a specific population. These are all the different things that you have to think through and gather the information to be able to better see how all of this works together. And then also realizing that sometimes there are things that are quite important, but the changeability is not as much there, or there's low changeability. So it's really important to know, do we see where those needs are? Are we able to address those? Do we have existing evidence-based interventions that can apply to that? Can change occur in a reasonable amount of time? We have to kind of go through that process and looking at all of those pieces. And so that's what we're going to talk a little bit more about here. Is I wanted to give you a little bit of the foundation of kind of what drives us in the different areas that we are to inform those decisions. And now we'll give you examples of what that looks like and how these in different parts of our state, we have seen collaboration, action come together and create such amazing opportunities to reach our community. And so with that, we're going to go with, we're going to talk about building up a coalition from the ground up. We're going to talk about the partnership of our local coalition, our coalition of coalitions, the partnership with the HIDA, and also the transportation. It's beautiful. And then one of our favorite partners is what we're able to do across our state because of the partnership that we have with the National Guard, DDRO. It's leveraging those efforts, we can really see a lot can be achieved and accomplished, especially for our state that's pretty long. We have 67 counties and we go pretty far from one side to the other. It's really, you can't even drive in one day to get across the entire state. So with that, we'll move into the next part. And so I'd like to introduce Nancy Castillo from our team, and she is been an incredible change maker in Putnam County to build up a coalition from the ground up to secure drug-free communities funding and support. And with that, Nancy, I will turn this over to you.
Thank you, Kathleen. Good morning, everyone. I also want to introduce Dale Schubert, who works with me hand in hand in Putnam County. And so you'll also be hearing from Dale. But just to recap a little bit about our coalition, we were approached in 2023 by the Putnam County Behavioral Health Forum. They wanted us to start a prevention coalition. And it was great because at the Behavioral Health Forum, we had already all those sectors that Kathleen shared earlier at the table. So the community was ready. And with that, we had our first official meeting September of 2023. We had no funding. So the fact that CCA and some of our local partners assisted us with the process the first year, if you can go on to the next slide, Kathleen. The first year of developing the coalition, we created some information tools for to educate the community on what was occurring. And so this, what you're seeing right now, we call it our county profile. And so at CCA, we're able to produce this document for all the coalitions under our umbrella. Next slide. In addition to that, we also had our needs assessment that we did the first year. And the needs assessment, you'll hear from some of our great partners, DDRO, National Guard, HIDA, were very instrumental in addition to the coalition members, the Behavioral Health Forum, in getting this accomplished. And when I say our partners helped, I will just cite an example with Captain Meghnadi, who's on here. She facilitated the risk and protective factors. How do we identify that? How do we create a problem statement? So it wasn't just Dale and I being able to do this. It was also relying on our partners. HIDA, who's not present, but you'll learn a little bit about them. They provided the OD maps for us and some of those trends that we were also able to include. And then we also created a snapshot of what our needs assessment was. And so this one pager allowed us to educate the community on what the needs were, what our mission was, what our goals were. And then a year later, we were able to receive funding for the first time. So we received the Drug Free Communities Grant in September of 2024. And so moving on, we are in the process of looking at the 2024 Florida Youth Substance Abuse Survey data and seeing what those trends are, what the changes. Kathleen came last month to our coalition meeting, shared that data, and saw also some of the substance abuse trend. So this is ever evolving. This is not something that you do one time and you ignore. In 2 years, our goal is that we will do the whole needs assessment process again. But in the meantime, those data shares are very important to see where we need to kind of shift in what we're doing in the community. Next slide. And so environmental scans, we are in the process of doing the Department of Children and Families. So in our coverage study, and that's a statewide, but in Putnam County, during our needs assessment process, the National Guard Sergeant Forsman, he went into several stores just to see what are the products being sold, what is advertising looking like, and then our awesome person at CCA, our marketing director, she created this one pager for us. So again, it's important for us to be able to share this with the community. Next slide. And so Kathleen already talked about this slide. We have all these sector representatives. For us is about making connections, and we are continuing to do that. And I wanted Dale to share we attended a local event on Monday night because one of our sector representatives really gives us the opportunity to connect with other individuals in the county. And this was something that her organization, a fundraiser that they were doing. And so Dale, if you could talk a little bit more about that and the connections that you made and the experience and then contacts also.
We can't hear you, Dale.
How about now?
We can hear you now.
Awesome, great. Thank you for
Awesome,
that. Yeah, so like Nancy was saying, through the Putnam Free Clinic, we were able to attend a bowling event that they were holding. It was a fundraiser for them, but it was also a way for us to have the coalition be out in the public and meeting with parents and children. There are quite a few youth there as well. So it was a really good event. We had a table there with a lot of product like Narcan and other information, and then we also had our goggles that distorted view, so the youth could kind of walk a path and see how drinking could ruin their balance and coordination. So that was kind of fun to watch and witness. And also through that event, we got to connect with some opportunities to do some programs at some local churches with their youth groups, and also with possibly some of the kids that are involved with the bowling team there, and also the Special Olympics. So we're really looking forward to following up on those contacts as well. And some of the other things we got to do in the community is meet with the school principals board and kind of tell them the kind of programs that we have, and possibly getting into the schools to meet with their youth as well through that. And then we also met with the city officials, also in partnership with Tobacco Free Putnam, to put signage in the public parks for no tobacco or vaping. So that was also a great partnership effort there. And then we also are now meeting with the PAL, the Police Athletic League, and we're hoping to also do some youth events with them as well. So a lot going on, and we're very excited about the future there and with the coalition and how we can move forward. Thanks again, Nancy, for letting me share.
Thank you. I appreciate it. And for us, we don't live in Putnam County. So the fact that the community has embraced us and they're helping us along the way and making those connections for us. And of course, it's important to have that follow through. And that's something that we take very seriously. So I'm excited what the future holds and what we're able to accomplish. Next slide. And so this is just a description of the sectors, the graph that you saw in the beginning. Next slide. And so with that, we're going to turn it to an awesome partner at CCA and an awesome initiative that I wish we could have in Putnam County later on. But I'll turn it back over to Kathleen.
Thank you so much, Nancy. And what we wanted to do here today is just give you an example of what can happen in such a small amount of time. I mean, if you just heard of when the coalition started having the official meeting to all of a sudden, here we are, very short time, with drug-free community support, with different partners in the community, inviting the coalition to come to events. And that's another example. It's not always about the having partners come to the coalition events, but the coalition offering to go to their events, to be a part of the community, and to be able to weave into meet their needs, not just what the coalition needs, but how do we partner with others so it doesn't become a one-sided partnership. And from that, so much has grown and opportunities have opened up. So it's been beautiful to see how all of this has evolved, the engagement, the willingness for having outside organization come in to be a part of the local community. It's huge and a huge win. So we're so proud of the work that both Nancy and Dale have been doing and the amazing partnerships they've made and connections in places we didn't even know they were going to make connections. It's been fantastic. All right, so now we're going to move to another example of community in action. And so we're going to move into the presentation about safety on the move with our coalition in Jacksonville, Drug Free Duval. So I'm excited to introduce Susan Pittman and Sally Finn to then talk a little bit more about their amazing coalition and what has blossomed with this initiative, because it's incredible.
Thank you so much, Kathleen. This is Sally Finn, and Susan will be joining me in just a few minutes. Loved hearing what was going on in Putnam County, and it just makes you realize that engaging with people in your community really does advance the coalition and the strategies, therefore the strategies going on in the coalition. One of the strategies with Drug Free Duval, and just for a little sidebar really quick, Duval County is located in the northeast part of Florida. We are 800 square miles, an enormous county. And we have several strategies that we implement in the county. One of those is the overdose and Narcan training, where we will actually either engage and go in person to talk to folks about the opioid crisis, along with Narcan and how to use it, but we'll also do that virtually. So late in 2023, actually, we were reached out by Jacksonville Transportation Authority, an initial conversation. Can you flip the slide? Perfect. There we go. And so we actually received an email from one of the trainers at Jacksonville Transportation Authority. They are our local public transportation group in Jacksonville. They currently have 830 employees. And the gentleman was interested in getting some training for his security team. And so we were super excited, and through multiple trainings, probably 5 or 6, we were able to train almost 75 of their security folks. And so they not only got the training, but they also had a personal Narcan kit that they were able to carry with them. An overdose occurred on a bus, and a life was saved. And so, gosh, that just showed JTA the value of that training, right? It was one life, but what a ripple effect that went through management. The conversation was, getting bigger. We need to train more people. And this is just one, one sector of our community, right? So we were very, very encouraged and very excited. As we expanded the training scope, moving into management, including talk conversation about bus drivers and then other staff, including risk management. And risk management, one of those trainings was where we kind of went to the next step. And if you can flip that slide, please. And so one of the head of risk management actually came up to us, and I will say at this point, and she knows that we share this, that she had lived experience with a family member who struggled with addiction. And so there was that, inner drive for her to not only want to make a difference within the community, but also personally, she just felt very called to do that. So she came up to us and said, "Gosh, Sally, this training is so valuable. What would you think about taking this out into the community?" And I said, honestly, we actually already do that. We do a lot of community trainings as people call or as people hop on our virtual calls. And she said, "No, we actually have a bus that was used during the pandemic to take COVID vaccines into the community. And obviously it's no longer being used, but it's just sitting in the parking lot. What would you think about if we made that into a Narcan bus?" was the initial conversation. And so that was unbelievable. And so that is how Safety on the Move was birthed. That was the initial conversation. And when I tell you that people, when they have a great idea and there is all kinds of backing behind it, we literally went from March of 2024 to the conversation about the bus to actually being in the community by October of 2024. The bus was wrapped. It was outfitted for us to go on and for folks to come on and get trained and receive a Narcan kit. So that was amazing in itself. Just that the willingness was there, the motivation was there, the dollars were there, of course. And that's how we got it up and running. And I'm going to hand it over to Susan now, and she's going to take the next couple of slides. So next slide, please. And I'm Susan Pittman. We are a mighty team of 2 over here at Drug Free Duval, and we couldn't do it without all of our partners, and we'll talk about that in just a minute. But the first thing that we really had to do once there was the general buy-in to the concept and the idea, we had to put some real legs on this process. What are we trying to do? And so we narrowed down the goals to promoting awareness that there even was an opioid crisis out there, and then trying to prevent death, right, through the distribution of Narcan, and also the knowledge of how to use it, the Good Samaritan Law, all the things that we've seen through all of our work throughout the United States that makes a difference, not in just having the product of Narcan, but actually being willing to use it. And so to do that, the things that we decided to really direct our attention to, we're focusing on improving community access to opioid education and awareness. Again and again and again, still today, it's so shocking to me that we can be out in the community and people can say, wow, really? We have an opioid issue? But we do come across that from time to time, and having this bus to move into various neighborhoods and or areas of business, et cetera, where people might not be aware, it's really made a difference. Another thing is we definitely wanted to be able to move into areas, address populations that didn't have access to resources. Maybe they knew about the situation, but either transportation was an issue, or sometimes people are even almost homebound, you know, they're in wheelchairs, et cetera. And services to get this training and information in the Narcan out there were limited. So that was definitely one of the big goals. We want to look at underserved and high-risk communities. So we'll get into the data piece in just a minute. But we definitely wanted to do this with the mobile training and outreach education, and we absolutely wanted to ensure that people were aware both of how to save a life and all the tools that are available. Wanted to get these into the hands of our Duval residents. So that's really encompasses what the vision and goal is of this project. Next slide, please. So now we made a plan. So our initial plan was that we would try to get the bus to go out 2 times a month. Our initial plan was 10 a.m. to 2 p.m. So it was a 4-hour training period. And when I say 10 to 2, I mean we are set up and ready to go. And actually we have people sometimes on the bus ready to get training at 10 till 10. And 2 o'clock is typically when we stop, although that time is adjustable depending on the needs of the neighborhood or the situation or the event, et cetera. But people are literally on it until the end, you know, and if somebody's on at 5 after 2, we do not stop. We finish and we clean up after they leave. We advertise the location on social media, and you can see here that we said hopefully traditional media and websites. We do websites, we do social media, and we have had great partnership from our traditional media here in the North Florida region. We have 3 major local news stations. All 3 of them have covered this particular project, and one in particular, like for our they gave us a 10-minute story. I mean, that's just unheard of, a 10-minute story. We did have a mom of a child who overdosed and died, and she shared her personal story. Really do make a difference, but it's really been amazing. We absolutely started out with this idea that we would have people sign up. You know, our vision was people would go to the website, they would sign up, they would use a QR code, they would sign up, that kind of thing. But you know what, that quickly got laid down because reality is people just show up. And so we do not turn anyone away. We do ask them to sign in. We don't require them to sign in, but we do ask them to. And for the most part, people are willing. We do gather a little bit of demographic information, not a whole lot, just, I can't remember off the top of my head, Sal, what is it, age, sex, maybe zip code, well, yeah. And the attendees all receive a Narcan kit. They also receive, though, a wonderful bag that is filled with all kinds of information, local resources, and things from our amazing partners. Now, let me tell you about our partners. First of all, you already know that JTA, that's Jacksonville Transportation Authority. They provided, as you saw, that beautiful wrapped bus. They provided some marketing. Every single time the bus goes out, they provide the bus, the driver. They provide us a security guard to accompany the bus. They provide the insurance that covers all of those things. We provide our insurance to cover us. They have provided some marketing materials like some flags, some, some like, come, free Narcan kind of thing. They also have provided support in terms that they always show up. They always spend a little bit of time at every event. Their board of directors got real excited. There was an amazing ribbon cutting ceremony. They invited all of us partners to be there and to speak. Kathleen also spoke at this. As you see, Community Coalition Alliance is a huge partner. They have provided all the Narcan for us. Thank you, Kathleen and CCA. But even more than that, I mean, the Narcan's amazing and we're so grateful for that. But in addition, they provide us humans, human capital to help us set up, to help us staff the bus, to help us do training, to help us stuff bags. They have been amazing in every way. And they provide some kind of fun item to go into this bag because people love to get stuff, right? We also, you can see in the left, there is ORS/HIDA. That is the North Florida HIDA and the opioid response strategy. They have been amazing. We use OD mapping so that we can see kind of where there are spike situations. Our goal, now that we have our first 6 months under our belt, our goal is to be able to respond more quickly and succinctly to spike events. We knew that the first 6 months we really needed to get the project established, but we're working on it now. We just had an all-partner meeting yesterday, and we're going to try to really work on that. And then, of course, there's drug-free Duval, and predominantly what we provide is we provide our training. In addition to the trainers, the training, we provide, some merchandise to go in the bags. Also, we provide manpower working alongside with Community Coalition Alliance, and HIDA also has provided some manpower. And it's just an amazing project. And I will tell you that, I don't know, Sal, you can jump in too, but the stories that we've heard, the community impact has been really, really great. Hearing people, we've had people that come all the way across town, and as Sally mentioned, we're an 800 square mile city, so that might be 45 minutes to an hour drive, and somebody will show up and say, oh my gosh, my son overdosed and died, or my next door neighbor is struggling, and I just really wanted to get this product. I want to understand. We've had people show up who say, I actually had Narcan, but I didn't know how to use it, so I'm so glad to get the education. It's just been a really gratifying project to be part of, and JTA has been a phenomenal partner, Community Coalition has been a phenomenal partner, and HIDA has been a phenomenal partner. One quick thing I want to add, so obviously we're there for 4 hours at the location. The training is every 10 minutes, it's rolling. So we do it 10 minutes, hand out the bag, answer any questions, they get off the back of the bus, and people are getting back on the front of the bus for the next session. And so it is, we've got it down to a science, 9 to 10 minutes. So in case you were wondering, wow, that's a long time for a Narcan training. It's not. Oh, yeah. It's not all 4 hours. Good point. Every 10 minutes. And that has worked really, really well. And we've trained to date, and we've done a total of 10 trainings to date, and we have trained 209 people. And, it's seeming to really catch some steam now. We think that this will continue to grow. And I don't know, Kathleen, is there anything you'd like to add?
I just think it's been such an incredible opportunity. The other thing I would add is that you were able to also be a part of weaving this into Take Back Day and Jack's Ready Fest, so that we're getting even more awareness and promotion and being in the community where people are going to see what's out there and what's available. And it really just opened up a lot of great opportunities.
Absolutely. And I think one other point, Kathleen, is oftentimes we'll get asked, hey, can you bring the bus to my location? And so obviously we take that into consideration. We'll go to the discussion, certainly talk to JTA, who was very flexible. The JTA reach actually goes into a couple of other counties as well that are bordering Duval, so we've been given permission to do that as well. So I feel like the sky's the limit with this project, and we believe that this is the only one of its kind in the country right now. So far, yeah. So far. So we like blazing trails as well. It's been an honor and a privilege to be a part of this. And JTA just won a national award at a National Transportation Association. And they said they had so many people come up. There may be people in your communities. If you guys could reach out to your individual transportation groups, transportation authorities. I don't know how you all are structured, but we would be happy to share information. JTA also would. They would love to share this. They'd love to see it expand through other transportation groups throughout the country. So yeah, it's been a real privilege and honor, as Sally said.
The other thing I would highlight too is that all of this happened in such a short amount of time. I mean, it's very rare that we see an idea as big as this turn into reality. And here we are, conversation, idea, boom, reality. And investment. They invested materials, invested time, they invested resources, and that's just fantastic. And they mentioned, we had a planning meeting yesterday, and that this safety on the move, this was just one topic that it started to talk about. But then we discussed, what about other safety issues, other things that this can turn into? So this is just the beginning of an amazing project.
Yeah, I agree, Kathleen. And we love that they chose to call it Safety on the Move, as Kathleen was just alluding to, because it does make it expansive as we have other critical need issues in our community, particularly around drugs, alcohol, et cetera. But also, we're looking right now at potentially adding a stop the bleed, CPR training from the bus, some different things that are all related to accidents, and particularly, people potentially using drugs or alcohol, an accident scene, et cetera, et cetera. So, and coupling with the Take Back Day and Jack's Ready Fest, do you want me to touch on that, Kathleen?
That would be great, yes.
Okay, so you guys all know what Take Back Day is, of course. It's a national thing. Well, it just so happens that we have something called Jack's Ready Fest, which is basically all of our emergency services, everything from private emergency providers to public emergency providers. So our EMS services, our hospitals, our who else is there? JEA, which is our electric authority. All these folks come together once a year and have a massive event in our, what do you call it? Our convention center. Thank you, Sal. In our convention center. Yes. And they have things inside and outside, and they have JEA guys climbing the pole to show you what it would be like to do an electrical fix in the middle of a storm. They have the ladder truck. They have the helicopter coming in and landing and leaving again. It's a very exciting kind of event. A lot of families and kids and elderly people will come, and they'll learn more about some of these things. Tons of great swag from hats and this and that, all that kind of stuff. So it does draw a lot of the community. And so we had the bus out there, and we also coupled Take Back Day with it, because Take Back Day fell on that Saturday. And so our city was willing to combine all of these things together. And I think it was really great for everybody involved, all the partnerships. So.
And I see we have a question. Victoria asked, what does the inside of the bus look like? What kind of tech is involved? So the inside of the bus is, all the seats have been taken out, the traditional bus seats. So when you walk on the bus, it is totally open. At the very back of the bus, or towards the back of the bus, where the side door is to get off, there is a desk with a monitor on it. That's where we connect our computers, so that shows our PowerPoint. We have chairs, portable chairs that we set up each time we take the bus out. It's air conditioned, which is an amazing plus, or heated. We don't need that as much in Florida, but the air conditioning is a big plus. Yeah, we just stuff the bags. We have those ready to go as soon as people come in. That we have a tent outside set up for those folks who step up and want to sign up or sign in, and they can stand in the shade if need be. If somebody else is on the bus, they hop on the bus. 10 minutes later, they're off with their bag, which contains obviously the Narcan, but also drug disposal bags, doTERRA. Thank you, CCA, for donating those, and lots of other valuable resources. And a few fun things too, as Susan mentioned. And that's, that's how the bus looks. So the tech is just basically connecting the laptop with an HDMI. I've got a flash drive with the training, and we are ready to go. So very, very simple. I need simple.
And they do have a generator, so we have we can plug in both our computer and the big screen. So, we have all the electronics we need, which are minimal, as Sal's saying. So I see that you're commenting that other topics might be like secure monitor, Absolutely, that would be very cool. We do have a program here in Jacksonville with lock bags, if you guys are familiar with those. One of our hospitals is distributing those. So that would really be, there could be a mini training on that too. As Sally said, we do this in 10 minutes. We do that on purpose. That wasn't initially what we thought. I think we thought initially we'd do 20 to 25 minutes. Our normal trainings run about 35 minutes. You know, when we do just when we come to somebody's office or whatever, 35 to 45 minutes, depending, because we'll dig into the particular industry, et cetera. But we just figured out real quickly. We have to cut to the chase. We do the absolutely important things. It's funny. Here's something that we've found that we have to tell people is there's no lid on the Narcan dispenser. You know, somebody came onto the bus and said, oh, I kept trying to take the lid off. I wanted to give somebody Narcan, but I couldn't get the lid off. Well, there's no lid. So we added that tiny fact to our training. You know, when you take it out of the bubble pack, there is no lid on the dispenser. You know, little things like that. We make sure people understand about the Good Samaritan law. We go data light, I would say.
One slide.
Yeah, one slide on data. Where in our own trainings that we do, you know, off the bus, we spend a lot more time talking about what has brought about the opioid crisis. We cut to the chase on the bus trainings. So let's see, there was also mobile response for seller server training. That could be really interesting. Mm-hmm. I don't know. I know that here in Florida, our DBPR, which is Department of Business and Professional Regulation, actually has an online training that many of our retailers use. So, you know, I don't know. It could certainly work in some areas, and maybe here. I think people are starting to want to go back to in-person stuff, so maybe. Yeah, that would be really good that employees would have the access. With an empty shell, so to speak, you can change your topics and training opportunities. Yeah. Absolutely, Victoria. That's one of the things that we think is so powerful about this. Yep. Well, if you guys want any help with the concept, just reach out to Kathleen and we'll all get together on it. Thank you.
Thank you both so much, and thank you for sharing out this amazing initiative. It just was such a powerful story to share, and it fits so perfectly with this topic here today, because what you heard here is what happens when you have connections, engagements, intentional information sharing, and a support system to create this amazing project. And this is just the initial. It's going to keep growing from here. So thank you so much for that. And we were going to have our partners from the North Florida HIDA here as well, but they had another emergency meeting to attend to. But they did share a few slides that we'll include in here for those of you that are going to have access to the PowerPoint slides, just so you know a little bit more about them. They were such a critical part of this as well, because they have access to data and information that otherwise we would not know about. So we want to give a shout out to both Deborah Babin and Scott Delano from the North Florida HIDA. They are the public health analyst and drug intelligence officer. They have a lot of great input and understanding in this and support. We have had such an amazing support system from the North Florida HIDA director for the work in prevention and being able to get the community engaged and creating the action from the data that we're gathering. So it's such a fantastic partnership, and they are such a critical partner to us for many other initiatives that we work on here at CCA and for our various coalitions. They are very involved, maybe even more so than some of the other HIDAs, just because of their support system from their leadership. But they join us with our regional drug epidemiology network meeting, our local drug epidemiology network meetings, so that we can bring that real-time data to the community partners and be able to have a lot of that opportunity to see the information and create the decisions from that. So we're trying to tackle as things are happening, not after the fact, like we see with the use of reports. So they've been such a great partner to us, and things like this, being able to share with us like the overdose map. So we know, even with like safety on the move, we can, if we see spikes happening, we can, you know, take that bus to those areas to share out those resources. So it's such a incredible opportunity to really show how data creates the action, and we can actually make that a reality. Our involvement, as they already shared, is we provide some of the access to these resources, as well as some of our staff. We've been in the news for this initiative, which is fantastic, and continue to see it shown. So and here is the beautiful ribbon cutting ceremony. It was so fantastic to see so many folks come out and hear about the initiative and be so supportive of this. It's not often you hear about Transportation Authority being a part of prevention initiatives. So we're thrilled that this is a reality. So we're going to move into our next partner share out. So we are so fortunate to have such an active National Guard drug demand reduction outreach team here in our state. I know they exist in other states. So if you don't know who your DDRO team is, I would suggest connecting with PTTC, who can connect you with those contacts. They are such an amazing resource to us because they have an understanding in prevention like we do. They are also trained in the strategic prevention framework. They have team members throughout our state. Our state is very long. We have 67 counties, and it is they're pretty spread out. So to have team members from their group in all different parts of our state has really helped to bring in additional support for local coalitions, for their community events, for drug take back, but then also we do a lot of work with them on trainings to build up the capacity of our prevention workforce. It's been a lot of amazing opportunities because we work a lot with coalition support. They do a lot of coalition community support. And then together we work to be able to ensure that we're addressing the workforce needs, bring in support, and look at some enhancement opportunities. So with that, I'd like to give the next set of slides over to Captain McNatty to join us here and share a little bit more about her amazing team and what they do here in our state.
All right, thanks, Kathleen. Hey, good morning, everyone. As mentioned, my name is Captain Gabrielle Mignanti. I am the State Prevention Coordinator for this is a long name, but the Florida National Guard Counter Drug Program, Drug Demand Reduction Outreach. Break that down for you. So every state has a National Guard. Within every single state, there is a counter drug program. Not necessarily within every counter drug program is DDRO. I think we're up to 42 states. You will find a DDRO program. So as I explain this program, know that something similar, if you are from a state other than Florida, something similar likely exists. And we work nationwide together with the other DDRO programs often. And I can promise you they are probably looking to work with you or your organization if it has, our guidance is as long as it has a drug nexus. And for us, that means if you're working in the area of substance use, substance abuse, substance misuse with the community. So with that said, I hope if you haven't heard of us before that you're able to track down somebody in your state. And if PTTC, excuse me, if you reach out to PTTC, I'm certain they'll be able to help you connect with the individual in your state from this program. But if I'm certainly here to help, as I have the running contact list as well for everyone in their respective states. So with that said, go to the next slide. I almost clicked my button. I don't have access. Thank you. So under the counter drug program, there are multiple missions. My mission is drug demand reduction outreach. You'll see that at the very end is mission 6. But our overall mission from the National Guard Bureau as a counter drug program is to assist federal, state, and local law enforcement agencies and community-based organizations, which is specific to us, in defeating the drug war. That's the way to summarize it best. So most of my counterparts are fighting the back end of the drug war. They are doing interdiction activities and surveillance activities on known drug trafficking organizations. We are the only one, again, that very last column there, we're the only one working on the front end of the drug war in the area of prevention. So counter drug headquarters, as with any headquarters, they run all the administrative side of things, but then we have technical support, which we are providing linguist support. We're providing investigative case and analysis support. So if there's an active investigation into a drug trafficking organization, we are working alongside all of the 3-letter agencies in a number of capacities in order to support those investigations and primarily the analysis of all the information that's being brought in on any one organization. And as you know, these things happen over many, many months and many years before any action is able to take. But our service members who serve in the Florida National Guard work full time for the counter drug program. Again, they sit in the same building, side by side in cubicles with the three-letter agencies, working to solve the investigation. And both them and us, the reason that this mission was created, the counter drug mission, is because the military does come with a very unique set of skills. There are things that we are learning that can be applied outside of the military. And in this case, it is with the analysis of financial records and cell phone records and the recon or reconnaissance, which means doing that surveillance with the local police departments or sheriff's office on a known house. And then on our end, in the prevention world, we have learned a lot about strategic planning in the military and execution of events, planning for the events, executing the events, and then doing proper evaluation after events, which we know is very important to the coalitions. So again, just to reiterate, we take what we have already learned in the military, what we were trained to do in the military, and apply it to the war that's being fought on drugs in our respective states through a number of different methods that I've briefed. Go ahead to the next slide. All right, so there's a lot of words on a page, but ultimately we do fall in line. You'll see at the bottom there, we do fall in line with the governor, our state governor's strategic goals, and then specifically with the Florida National Guard. I'm sorry, with the National Guard. Every National Guard has an adjutant general, which is the top boss in the National Guard. We make sure that we are aligning with his priorities as well, in addition to the Department of Defense. And then again, the very last one there, but probably the most important, is anybody who has an interest in supporting substance abuse prevention programs, we are going to work with them. Just to hop back up to the top real quick, as Kathleen mentioned, we are trained in SAPST. Additionally, there is a military version of SAPST that every new DDRO operator must take. And we go through DDRO phase 1, and then we go through DDRO phase 2 after we've been on the job for about a year, which increases our abilities to give back to the coalition or organization by teaching facilitation skills. With that said, everybody has to go through the civilian version of SAPST. Some of our operators have gone as far as becoming SAPST trainers. And so that just reinforces the message that Kathleen sent and the others on the call, that's how we build capacity, is not just to teach a bunch of people, but to train up people to do the teaching. And so then we can offer those trainings statewide, because that's where my folks operate. And I'm thinking now I should put the map slide further in the front of the presentation so I can kind of give that picture of how widespread we are in the covering the different areas. But lesson learned for next time. You can go on to the next slide. This is just our mission statement, but if I can call your attention to the area that's bolded. Again, increase the community's awareness and capacity to identify the needs and address those needs. And then become a force multiplier. So this is a military term that we use, but the way I explain it is whatever the community-based organizations are out to do, we are there to get it done, help you get it done faster, help you get it done at a greater level, help you be more prepared for it. Whatever the it is, it can be an event, it could be an initiative, it could be trying to get somebody to the table. Whatever that is, we stand by those coalition members and leadership and say, let us help you. We do work full time. We're not volunteers. So again, our sole job is to implement substance use prevention in the communities, but doing it side by side with the community-based organizations. Part of the hat we often wear is connecting the folks in the community or the organizations, those community-based prevention organizations with law enforcement agencies or law enforcement personnel. Because both law enforcement and military wear the uniform, sometimes we can speak some of the same language. We can get people to the table that maybe the average civilian could not. That's just how things work, unfortunately, fortunately, and unfortunately. But people in uniform like to see other people in uniform. And so we're able to share the message of the coalition with the law enforcement folks, and oftentimes get them to come out to an event, support an event, come out to the coalition meeting. And, you know, I've seen some coalitions where the sheriff, one of the members of the sheriff's office is, you know, on the board of directors. They're that involved because they are that passionate about what's going on. And so it really does vary. But yes, as a law enforcement liaison, I would certainly say we hold that role often throughout the state. Go ahead to the next slide. So I want to go through these. This really helps describe what we do, what our role is, what our purpose is. And if you can do me a favor, Kathleen, if you can go 1, 2 slides. One more. Perfect. So I'm going to start here and then I'll go back. But this is the hierarchy of the support roles that you saw on the last 3 slides. And the purpose of depicting it as a hierarchy is because when we first get involved, or when we first come on the job, we are just support and a participant. We are going to show up at your meetings. We're going to show up at your events. We're going to gather information about how we can help maybe next time. Maybe you might be comfortable in the beginning to say, hey, can you do this? We need your support with this. We need your help with this. Can you connect us with so-and-so? But in the beginning, we are just a presence. But as we move up and as we move forward and we are with your coalition or your organization more often, and you see us month to month, you see us at the events that that the coalition is holding, we'll move into that leadership coordinator role. What do I mean by that is that many of my operators have been asked to step on and be on a board of directors, on an executive council, because we do come with those leadership skills that are inherent in military service members, and that's usually recognized very quickly. So after that initial just support participant role, we often will move into some type of leadership, or, hey, we're about to have an event or we need a subcommittee formed. Can you coordinate getting everyone to the table? Sure, no problem. And we're happy to do that with our community-based organizations that we support. Now, those last 3 at the top, coaching, facilitation, and training. I already mentioned training. A lot of us are trained in SAPS and some other things such as Know the Law, mental health first aid. So if a coalition wants to do that training in their community and they're short an instructor or a couple of instructors, we're able to provide that support for them. And then the facilitation is extremely important. Most of us have probably been a part of a planning group or a planning activity where we're all sitting at the meeting, or a specific subcommittee has been formed to develop the logic model, maybe to develop the action plan. But there has to be a person at the front of the room working that room and making sure that the goal is met and that input is drawn from everyone in the room. And then a final end state or a product is created that makes sense and is able to be used. The person at the front of the room is a facilitator. So that's a really important role that many of my operators have been taught how to do that. That is through phase 2. And it really takes the load off of the leader of the coalition, the leader of that community-based organization, because they can sit back and make sure, maybe do more of the logistics side of it versus, sometimes if you find that individual up at the front of the room, you might just want to go in line with what they're saying because they also lead the coalition. That temptation is removed when there's an unbiased person at the front of the room leading these planning sessions or, the development of products for the strategic prevention framework. And then last but not least is coaching. We're also trained in to be a coach for the community-based organization or the coalition that we work with, in that it's your typical definition of coaching, but not to say that we know how to do it better, but we've learned some strategies to do different evaluations at the end of the year, after, at the end of each quarter, or we can also offer up whether or not you know, hey, the method which we use to plan that really big thing we do every year, let's switch it up a little bit. And we offer that insight at the coaching level. Again, that's only after we've been with the coalition for a while and we're comfortable with them and the leaders have decided that they can trust us, and that they can glean knowledge from us. So we kind of move through that path over the course of the time with the coalition. I personally have been on the program 8.5 years. I have somebody that we hired just 6 months ago, and everybody in between. All 15 of my operators are somewhere between 6 months and 8.5 years. So different levels of experience. Go ahead to the next slide. And I won't stay too long here, but this is a commonly discussed so what I'm looking for. The strategic prevention framework is discussed among prevention professionals often. If you'll look in the bubbles, though, the different color bubbles, you'll see where we specifically contribute with regard to assessment, capacity planning, implementation, and evaluation. But we live in the areas where we work, so we know the geography and the history. We absolutely can increase readiness and resources. We have local armories. If you know about the National Guard, they drill at their armories. Those buildings are big, they fit a lot of people, usually pretty well equipped with technology. So when the coalitions need a place to support an event or a large meeting, we're able to offer that up, and it's typically free of charge. You know, goal development and objective, we do that in the military all the time. And then action planning, evidence-based prevention programs, we go in the schools, we talk to the kids, we understand the importance of evidence-based. And then afterwards, with anything, especially what we do in the military, is doing that evaluation, monitoring the impacts, making sure what we did worked. And sometimes our role in the military, and I'll give you an example yesterday, sometimes our role as a DDRO operator is to say to the coalition, because sometimes they're really quick to move on to the next event because they're so busy and they want to squeeze in everything they can in any given month or year, to say, hey, let's talk about what just happened, what worked, what didn't, what do we need to change moving forward. And that is ingrained in us in the military because we call it an after action review. Every training event, every deployment we go on, anything we do, whether it's an hour or a year, we're sitting down at the end, looking each other in the face and saying, what went right and what went wrong and how do we change it next time? And so it's natural for us to bring that into our work in prevention in the communities that we support. And so yesterday we had a really productive call. Take Back Day, as you know, was this past weekend. And so we sat down with all the partners who we spent 1.5 months, 2 months planning before Take Back Day. We sat down with those same partners and said, all right, we did all the planning we could to make sure the day went flawlessly. What went right and what went wrong, and how do we prepare better for October? And I was able to facilitate that meeting. I didn't guide anybody in one direction or the other. I let everyone speak, make sure the right people were at the table, gathered the notes afterwards, and then we'll review them when October comes around. So that's just an example of one of the many ways that we get involved with the community-based organizations. Kathleen, you can go to the next slide. I talked about most of this on the last slide, so I'm going to let you go ahead and skip to the next one. Okay. And then this is just a generic slide, but prevention for change. So there's a lot of research out there, and we as professionals, both all of you on the call and myself here speaking, I just noticed somebody in the chat. All of us rely heavily on research, and I know that Kathleen mentioned it and mentions it all the time about how important research is to what we do and making sure that we're basing what we're doing on data. But at the bottom there, you'll just see how we move from the coalition operational and problem-solving capacity all the way over to achieving population level change. And that photo there is interesting. It's actually a coalition meeting where one of the DDRO operators many years ago was working, and that is she is holding a meeting to conduct the Kaizen survey. You may have heard of Kaizen. It's a theory that talks about change and how to implement change. And what she's doing is every member back in the day had clickers in their hand, and they were answering questions about the coalition, about the mission statement, about the logic model. Did they have a piece in it? Did they agree with it? And you get that feedback from everybody in the coalition. and then the DDRO operator will get the results from everybody, and sit down with the coalition leader to be able to say, hey, here's what the members of your coalition feel. They feel that they were involved in this, that they do or don't support these different parts of your strategic prevention framework. And then you develop a plan between the coalition leadership and the DDRO operator to improve on the areas where there's room, and then capitalize on the areas where your coalition members said you were succeeding. So that's a wonderful tool. It is absolutely still available if you have a DDRO operator. In your state, they can assist you in doing a Kaizen survey. Next slide.
And Captain, we are coming to the end of our time here.
Yes,
Just realized that.
Sure,
Sorry
no
about
problem.
that.
No worries. Just spend a second on this slide. These are our numbers since we started back up in late 2017. But the Take Back Day events that we've supported, here's some of the poundage that we've gotten back. We've trained over 200 soldiers, airmen, and civilians because we are SAPS trainers. And then our night vision is our in-school presentation that we deliver to the students. And you'll see our numbers slowly climbed over the years as we passed. And these are the number of students throughout the whole state of Florida. Go to the next slide, Kathleen. I think it's just the map. It should be. Yep. And there's the map of Florida. The only white is in the panhandle up there. And this map was made in January when we were originally going to brief. And since then, we have hired somebody and he has started to cover those counties. So we really do cover from all the way over in the tuck of the panhandle down to Key West. I have operators in their communities doing prevention. So, and that's how we're able to support all the other folks on this call in whatever their initiatives are, because our hands and feet are all the way throughout the state of Florida.
And we are so grateful to DDRO. We could not have done the work that we've been doing without their support. They give us support in so many ways, from their availability of their buildings, to coming in and teaching with us with SAPS training, to going out to the events that we do and assisting with some of the assessment process pieces. There's so many different ways. We put in a list here. I know we're coming to the end, but we hope today you've been able to hear examples of how collaboration can go to reach amazing things when everybody's coming together. They're being intentional. They're relying on the data, the research, and the opportunity to work together. We can't do things in silos. We have to come together with this, bringing in all the different sectors and being intentional with those different opportunities. So we thank you for the time here today. I know we're right at our time. And so thank you. All of the slides will be made available so you can get all of this information here. And we hope this was helpful to you. You learned a little bit more about our state and prevention and how we like to work with each other to really bring in the best that we can to create population level change. So thank you for that. And I will turn it back over.
Yes, thank you so much, Kathleen and partners. What an amazing example of how working together with partners can mobilize a community and enact change.